Hi everyone, this video will briefly go over type 1 diabetes. Type 1 diabetes is a chronic autoimmune disorder which is characterized by the destruction of insulin-producing pancreatic beta cells. The pathophysiology is quite complex, but I will go over the key details on the next slide. It typically presents in childhood or early adulthood, and it results in hyperglycemia in the patient due to the lack of insulin which is needed to drive glucose into the cells and out of the bloodstream. As previously said, it is a complex pathophysiology and it involves the genetics and environmental factors. But essentially, in patients with type 1 diabetes, there is an initial trigger for the autoimmune response, and this trigger is not completely well understood. Some studies suggest that viral infections or exposure to certain chemicals or foods may trigger an autoimmune response, but nothing has been proven to the full extent. What we do know is that once the autoimmune response is initiated, immune cells attack the beta cells within the pancreas, which leads to a progressive decline in insulin secretion, which results in hyperglycemia and the classic symptoms of diabetes. As a result of the lack of glucose entering the cells, you get a buildup of glucose in the bloodstream. The body then has to switch to an alternative energy source, which is the breakdown of fats into ketones in the liver, and that is ketogenesis, and is the natural response to low insulin levels. However, in patients who are type 1 diabetic, you can get excess ketone production, which can cause diabetic ketoacidosis, which I will go over very briefly later. With regards to the immune response, you get the antigen-presenting cells, such as macrophages or dendritic cells, activating T cells to attack the pancreas. The beta cells then are recognized by those T cells, and those T cells proliferate and release cytokines such as interferon gamma and interleukin 2, which then recruits more immune cells and stimulates the destruction of those beta cells. You also get killer T cells, which attack beta cells directly, and also you can get the activation of B cells, which produce autoantibodies that target the beta cell antigens. And we then use those autoantibodies to detect them through blood tests to see whether patients are type 1 diabetic if they have atypical presentation. More important is that in chronic hyperglycemia, there are micro and macrovascular complications, which includes retinopathy, neuropathy, cardiovascular disease. With regards to the clinical presentation, your typical presentation is polyuria, polydipsia, weight loss, someone who's young, and they may also be vomiting or be nauseous. However, as previously mentioned, you can get patients who present in diabetic ketoacidosis, which is an emergency, and they present with something called Kussmaul breathing, which is a very deep, rapid breathing, a pear drop smell, so like a sweet acetone smell, or abdominal pain and reduced consciousness. As it is a medical emergency, it needs immediate treatment, and there will be another video discussing ketoacidosis in detail and how it should be managed. With regards to their investigations, you firstly can do a fasting glucose, which typically would be raised and be at 7 millimoles or greater. Or you can do a random glucose test where the patient doesn't have to be off food for a prolonged period of time, and a positive test would be more than 11.1 millimoles per liter. You can do a urine dip, which could be positive for glucose and ketones, again because you can get the spillover of the excess glucose and ketones from the bloodstream into the kidneys and then into the urine. Lastly, you can also do antibody testing, and you only really do it to distinguish between diabetes types in patients who have atypical features, and those atypical features are onset after the age of 40 or 50, a BMI of more than 25, or a long prodrome period of illness. The most common antibodies tested for are the anti-glutamic acid decarboxylase, which is present in 80% of those with type 1 diabetes. The islet cell antibodies, which are in 70 to 80% of those with type 1 diabetes. And then you have insulin autoantibodies, which are present in 90% of children with type 1 diabetes, but only in 60% of adults with type 1 diabetes. With regards to the management, you need to do regular HbA1c, usually every 3 to 6 months. You also need to monitor your glucose very regularly, at least 4 times a day, and it should be done before each meal and before bed. but it should also be done before every snack, etc. You got two types of insulin treatment. You've got basal bolus insulin, which is multiple times a day, usually twice daily, and you get rapid acting insulin, which is to be used before meals, and it is the mealtime replacement of insulin that people who do not have diabetes would normally have whenever they eat a meal. With regards to some general advice, the dietary advice is necessary, and you might want to give metformin to people if their BMI is greater than 25. But most important is that patients stay engaged with the services in order to receive appropriate care, as spotting complications of diabetes early is necessary in order for patients to live the best life possible. That was a very brief overview of diabetes. If you have any questions, feel free to leave them down in the comments. Other than that, thank you so much for watching, and I hope you consider subscribing.